To summarise where we are, we have to face the fact that we've got two big things happening at once in our fight against COVID. One's working for us and one working against us. On the plus side, we've got two valid vaccines and we're racing, as I say, to get them out. On the downside, there is a new strain of the virus which is spreading much faster and surging across the country. And we've seen a 40% increase in cases in England in the last week alone, almost 15% more patients in hospital, more than at the peak of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April. So at this critical moment, with the prospect of freedom within reach, we've got to redouble our efforts to contain the virus. And that's why the Health Secretary has announced that more areas of England will be moving into Tier 4 from tomorrow. And I say again, no one regrets these measures more bitterly than I do, but we must take firm action now. And that's why we have to think very hard about schools, because today, of course, it remains the case that keeping children in education is a national priority, and it remains the case that schools are safe. But we must face the reality that the sheer pace of the spread of this new variant requires us now to take even tougher action in some areas, and that does affect schools, and let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means not meeting up with friends or family indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. I think the best answer I can give at the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment, but I can tell you that we are shifting heaven and earth to roll them out as fast as we can.